Hi, retirees. It's Ashley with Complete Health Benefit Solutions. So I'm going to walk you through how you can keep a railroad benefit plan, and then, as I referred to it, the secret sauce to making it affordable. So you're not spending almost $1,300 a month on COBRA, because that's astronomical. That's a lot of money. But also really minimize your out-of-pocket cost, where in most situations, you're not going to pay a lot of money out of pocket for healthcare with these plans kind of packaged together. But like I said, this is going to be very detailed. So I'm really going to ask that you hang in there with me, hear it end to end. If you watch the video, I will send you links where you can go directly to the carrier site and run quotes yourself so you can see exactly what the price is. Choose from some variations of the benefits. You know, if the benefit is richer, meaning it pays more benefits or covers more benefits, the premium is going to be higher. But you can kind of play with that and see it for yourself. If you feel like you have a full grasp on it and want to go ahead and enroll, you can absolutely do that. And like I said, the links will be straight to the insurance company's website. The links are attached to me, so I do ask that you follow the link that I send you. And if you go back to it at a later time, go back to that link. That way I'm able to know, that people were enrolling or found the information helpful. So at the same time, please, please, please do not hesitate to reach out to me with any questions that you have. If you just want to kind of check yourself and see if you're understanding correctly, if you want help with enrollment, any of it, please don't hesitate to reach out. I'm sending out this kind of DIY version, do it yourself, only as kind of a last resort. I know there are so many retirees that have requested information that I haven't got a chance to talk to yet. And with the busiest season of the year coming up, I did want to make sure everybody at least had this detail available to them so they can make appropriate decisions. Before we get into the details, let's talk about some benefit rules. So as far as the railroad plan that we're going to talk about, because this is a package, it's a plan from the railroad, adding on some additional benefits to make it more robust. It's going to save you money on premiums, but the real purpose of the additional coverages are to protect yourself from financial exposure if something does happen. But in regards to your eligibility for the railroad plans, which plan you're eligible for, I'm not going to have that information. Most likely you're going to want to call United Healthcare. They should be able to confirm for you if you will be eligible for the benefits under group number 23111. Because that's what this is going to be in reference to. If you're eligible for benefits under group number 46,000, you should be eligible for benefits under group number 23111. But again, call the railroad, call United Healthcare and confirm that with them. It is my understanding that if you're on COBRA, and you think that these benefits will be a good fit for you and you want to change plans, it is my understanding that you can drop COBRA and move to this option at any time. So again, my disclaimers, just because I'm sending this out and talking through it, please don't hesitate to reach out, call, email, whatever you're more comfortable with, and ask me any questions that you have. I never want anybody to move forward with something that they're unsure of and not comfortable with. So without any further delay, we will get into the benefits. So I am going to pull up benefit details and kind of walk you through exactly how they work. So the first piece The railroad plan that you will get to keep, which means you keep your doctors, there's no change in your network. Really the big change from if you're on the active plan, the early retiree plan, or COBRA, is that the benefits are different, which we're going to walk through, and the price that you pay. So the railroad plan that works best with this package and allows you to save a significant amount of money is called Plan A. Again, that's on group number 23111, Plan A. Now, I'm going to pull up a grid that shows us plans A, B, and C. If you're on COBRA, you have your benefits on group number 46,000, and then plan E on this 23111. So let's take a look at A, B, and C. We're going to be focusing on A though. Here are the options that are available through United Healthcare. And it's important to note that these are going to be available to individuals who are not corporate. So for example, if you retired from UPC as a non-agreement employee, these benefits do not apply. So for example, again, UPC employees have a COBRA option of a high deductible health plan. I think the premium is around $750, and do not have access to these plans. So these are available to agreement employees at retirement. I'm not sure how to help with that. But these are the benefits that the vast majority of spouses of retirees do have available to them when the retiree goes on to Medicare. If you have questions about what benefits you are eligible for, contact your current insurance company or contact the railroad or your union to confirm. So again, this option could be available to some, not all, but like I said, the vast majority of agreement retirees or the spouses of are going to have these options when the employee goes on Medicare. So as you can see, they have options A, B, and C under group number 23111 and COBRA. This document clearly explains that A, B, and C are more affordable coverage options than COBRA, but there are some important plan differences. It does state that the core benefits provided on each plan are the same. So the deductible, the out-of-pocket max, and percent of eligible expenses. And so that's referring to the coinsurance that you pay after the deductible is met, does vary. But for the most part, what is covered is the same. It's just the level of benefits that differ. So looking at the benefits here on the next page, you can really see the differences between A, B, and C. I included the premiums there at the top. So you can see Plan A runs at $455 a month. Plan B is $618 a month. Plan C is $803. What we're looking at is Plan A because we want to keep that premium low. That way we can couple other benefit packages along with it, still keeping the premium affordable, but really maximizing the benefits that you get for the money that you're paying in premiums. So Plan A has an annual deductible of $1,000. You'll see that out-of-pocket maximum is really high at $15,000. Don't let that scare you off yet. One important thing to note is the lifetime maximum benefit of $500,000. Depending on the state that you live in, there are now plans available that are considered short term. But you can go through underwriting one time and be approved for 2 or even 3 years worth of coverage. And those plans, although they have really high deductibles, do have a $2 million out-of-pocket maximum or lifetime maximum on there. I'm sorry, not out of pocket, a $2 million lifetime maximum benefit. And so compared to this 500,000, if that worries you, there are some other options to consider. You may want to reach out to me to work through that. But looking back at the plan A, you'll see down here the 50% of eligible expenses after satisfying the deductible. And that is really, for the most part, the benefit across the board. So you're not going to have co-pays for things like ER, emergency room, or your physician's office services, anything like that. You're going to be subject to first paying this $1,000 deductible. Once you've satisfied that $1,000 deductible, you're going to pay 50%, and the plan is going to pay 50% of the eligible expenses up to the $15,000 out-of-pocket maximum. What that means for you is that in any given year, you are not going to pay more than $15,000. So once you've paid $15,000 out of pocket, the plan is then going to pay 100% of your covered expenses, all the way up until either the calendar year ends or the plan year ends, or you've reached this policy maximum of $15,000. So these benefits really are pretty straightforward. Like it said in the previous page, the core benefits are the same for the most part, even including the COBRA plan. The real difference is going to be in these main categories, which is the deductible, the coinsurance, and the out-of-pocket maximum. And of course, the better the deductible, the lower the out-of-pocket maximum, the better the coinsurance, you can see the higher the premium. One thing to definitely note on these plans is prescription drugs. None of these plans cover prescription drugs. So for some people who are on multiple very high cost drugs, COBRA may be the best option, simply for the drug coverage. Now, there are definitely ways to navigate and resources available to utilize for drug coverage. I helped the spouse of a retiree in Nebraska recently who was on very expensive insulin. The insulin alone was about $1,500 a month. And she was on multiple other medications as well. But utilizing some resources like GoodRx and manufacturer, so the drug manufacturer coupons, we were actually able to lower her out-of-pocket drug costs. So that's without insurance, what she would pay for medications down to $164 a month. It's a whole lot more than the $5 per prescription that she's paying today. But when you're weighing that out with the almost $1,300 that the monthly premium is for COBRA and what we were able to insure her for outside of COBRA, the math all netted out to in her benefit to go without the prescription drug coverage, which would only be available on the COBRA plan, and go with some alternative coverage. So I'll get into some examples like that so you can see how all the math works out. But this should give you a good idea of how Plan A works. Very simple. $1,000 deductible. Once you've satisfied that $1,000, you're then going to pay 50%. The plan is going to pay 50%. until you have spent $15,000 in a single calendar year out of pocket. Once you have spent that amount, the plan will pick up the rest for that calendar year. So the plan will pay 100% until you've satisfied this policy maximum. So don't worry. There are things we can do to not only mitigate your exposure to that $15,000 out-of-pocket maximum, but also potentially have it to where you pay very little to nothing out of pocket, even while you're satisfying this $1,000 deductible. So we'll take a look at that next. So now that you've seen the benefits for Plan A, which you might not be too impressed, you're probably thinking $15,000 out of pocket is very, very high. It is, and that is exactly why we also couple Plan A with some other plan designs that will help minimize that out-of-pocket cost for you. So before we jump into those details, I do want to take some time to explain what an indemnity plan is. If you've never heard of an indemnity plan, it is not major medical. It does not function in any shape or form the way that a medical plan like what we just went over works like. It does not function like the plan that you had when you were under the active employee coverage or the early retiree coverage. Indemnity plans do not have a deductible. They're what we call first dollar benefits. And what that means is the plan pays first. So you don't have a deductible to meet before the plan starts paying. There's no co-insurance that you ever pay. Sounds pretty great, right? So, of course, there's a flip side. How indemnity plans work is there is a schedule of benefits that it lists every single benefit that is covered under the plan, and it lists a specific dollar amount for each one of those services. The dollar amount listed in the policy is exactly what the plan is going to pay. No more, no less. When a claim is filed to an indemnity plan, it is not going to pay any sort of attention or make any sort of consideration for the dollar amount that the provider billed for the service. What they are looking at when a claim is filed on the itemized statement from the provider is what service was rendered. Is that service covered under the policy? If it's covered, it's paying out the benefit amount listed in your policy. They're not going to pay more if your bill is much more than the benefit amount. They're not going to pay less because the bill was less than the benefit amount. It's actually very black and white. You have a service that's covered within your policy. The plan is going to pay the dollar amount stated in your policy. Coupling it with another plan like Plan A, it really serves as kind of paying your medical bills for you. We're going to jump into the benefit summary. I think you're going to be excited that you're going to see that there's really not a lot that this plan doesn't cover. So when we consider only paying $455 a month for Plan A and the cost of these plans, which we will get to, I think you're going to be really impressed and excited that you can be in a situation where you very likely won't have high out-of-pocket medical costs. And that's exactly why we consider so strongly Plan A, even though it has that $15,000 out-of-pocket maximum. With an indemnity plan coupled with it, it's not likely you would ever see that $15,000. So let's dig in to Health Protector Guard. It's also a product from United Healthcare, completely separate animal though. It's United Healthcare individual underwritten by Golden Rule, separate business entity. Let's take a look at the benefits. We're going to review the benefits of Health Protector Guard, which is the hospital indemnity plan that United Healthcare offers. Obviously covers a lot more than just hospital services. You can see here it also covers surgical services, doctor's visits, wellness and preventive care, some pharmacy services, and outpatient services. Some of the key things to understand, again, indemnity plans do not work like major medical insurance or the insurance coverage that you are used to. It's first dollar coverage, so there is no deductible or coinsurance for you to meet. You do not cost share with the plan. So, key features: you can choose any licensed doctor or hospital in the facility. There is a network that does help with discounts, especially if you're not pairing this with another plan. But if you do have insurance through another major medical plan, then as you can see down in the bottom left-hand corner, you're going to want to stick with that plan's network to receive the discounts on that plan and make sure that your benefits are covered. There's no lifetime maximum benefit. So unlike some short-term medical policies or retiree benefits that may have a dollar limit maximum that it will pay in benefits in a lifetime, this indemnity plan does not have a lifetime maximum. And this is difficult for some people to kind of wrap their heads around or keep in mind, but United has it here, I highlighted it, but they put it in bold and underlined some of the text to remind you that there is no coordination with other forms of insurance, which means it doesn't matter if your major medical plan denies the services because they're not covered underneath that plan, or if they deny it because the doctor was out of network and there's no out of network benefits. They also are not going to coordinate how the other insurance process the claim. So if you have another insurance plan that paid your claim in full, meaning you had no financial responsibility, still does not matter. You are going to receive the benefits that are set within the policy that are a fixed dollar amount for the covered service. Again, underlined, regardless of when or how other health insurance may pay the claim. So let's look at some of the other details. First, hospital. We're going to use this Choice Plus plan as the plan that we're going to talk about through all the examples. So there are 6 different variations of the Health Protector Guard plan. As you can see, the benefits from Choice Value all the way to Premier Plus get richer as you go down the line. As you're probably not surprised, the premiums are going to increase as you move from Choice Value to Premier Plus as well. I find usually that when you're pairing this indemnity plan with another sort of coverage, whether it's a retiree plan, a short-term medical plan, or, a high deductible health plan, that the Choice Plus gives you really good value and really good benefits and while keeping the premium reasonably low if you're paying another premium. Now, if somebody were to use the Health Protector Guard as standalone coverage by itself, I would like to see them towards this further end of the spectrum with a Select Preferred or Premier Plus. So I've definitely had clients enroll in the Select Preferred plan as a standalone. If this plan was available in the state that I live in, I would probably enroll in the Select Preferred as a standalone. But Most people will pair this with another plan. Choice Plus is kind of my go-to, so this will be our example. So as you can see, this is what is called the schedule, and there are several different benefit categories, and this is just hospital services. We're going to move through several more, and for each service, there is a set dollar amount for the plan that it's going to pay. So let's use an inpatient hospitalization as the example. So if you are confined to the hospital, which means you have been admitted to the hospital, this is not observation, this is not while you're in the ER, but you've been admitted to the hospital. With the Choice Plus plan, your benefit is $2,000 per day. So that means that this plan is going to issue payment of $2,000 for every day that you are confined, inpatient in the hospital. If you happen to be confined to the intensive care unit, it's going to pay $4,000 per day. That is in addition to the $2,000 per day. The ICU is limited to 31 days. The regular inpatient is unlimited. So you could be inpatient in the hospital all year. Say you have a horrible, blah, blah, we're going to cut that out. So let's say that you had a massive stroke or heart attack that resulted in being admitted to the ICU for 2 weeks, and then you remained inpatient in the hospital for the rest of the year. This plan would pay $6,000 per day for the 2 weeks you were in ICU, and then $2,000 per day for the rest of the year. That is an extreme example that most people would not experience, but just to give you an idea of how the plan works. Emergency room, $200 up to 2 times per year. It's going to pay $500 towards a ground or water ambulance, and then up to $5,000 for an air ambulance. Again, that is per year. The increasing injury reimbursement, which is this kind of sliding scale that you see here. Anytime you're admitted to the hospital because of an injury, that benefit is going to increase. So how much the plan is going to pay for, again, an admission due to an accidental injury is going to increase between years 2 and 5. So the first year it would pay $2,000 per day, and then increase every year up to year 5. And then year 5 going forward, it would pay $4,000 per day. And that's just for the hospitalization due to injury. So then looking at surgical services, the base benefit amount for the facility, because usually when you have a surgical procedure, you're going to have multiple providers billing for that service. So for example, if it is an outpatient surgical procedure, the facility itself is going to bill, the surgeon is going to bill. If there is an assistant surgeon, they may bill separately, and so will the anesthesiologist. The choice benefit is going to pay towards up to 2 surgeries per calendar year, $500 per day. So if you have more than 1 surgery in one day, you're still only going to get the $500. But then what it's going to pay towards the surgeon depends on these tiers. Now, unlike the hospital, this benefit changes based on how long you've been covered under the plan. That is not how these tiers work. The tiers down here are based on the type of surgery. So you'll notice tier 1 pays the most. It's going to pay $10,000. And then that number reduces down to tier 4, where it only pays $500. So tier 1 is going to be a significant invasive surgical procedure that's probably going to require anesthesia, some sort of open incision. It includes open heart surgery, a major organ transplant, brain surgery. So that's why you see that dollar amount much higher at $10,000. A tier 2 surgery is going to be not a diagnostic procedure, so it can't be exploratory. There would likely be an open incision, require anesthesia, things like knee replacement, hip replacement, stuff like that. That's going to pay $5,000, and then, as the seriousness of the surgery decreases, so does the amount that it pays. The assistant surgeon and the anesthesiologist are going to be paid at a percent of whatever benefit your surgery falls under here. For doctor's visits, it is going to reimburse just regular doctor's visits. The Choice Plus will reimburse up to 2 visits a year, $100. So that's definitely a decent place to fall for somebody who is healthy. It's also kind of encourages you to utilize maybe some other benefits such as telemedicine, or if you're saving a decent amount of money, this may be a place where you may have to pay for a visit or two out of pocket, but you're likely saving a lot of money with using this plan and another medical plan compared to other options available. And it's just kind of one of those concessions that you have to make. But for people who are healthy and don't have to go to the doctor too many times in one year, this will definitely help offset the cost of at least 2 visits per year. There's a separate once per year benefit of $250 if you wanted to get a second opinion on a surgery, so second surgical opinion. It does have a cool benefit that allows you to roll over. So from year to year, any unused doctor's office visits, this also applies to urgent care, remaining at the end of the calendar year into the next year. So they won't let you accrue that forever. You can only roll over a maximum of 5 visits each year. But if the first couple of years you had this plan, you happen to not go to the doctor at all, or you didn't file claims for it for whatever reason, those 2 visits would roll over. That next year you would have 4 available to you. You can see that some of these more expensive plans have more visits that it pays for. Like I mentioned, Select Preferred earlier will pay it to 10 visits at $100. There is a wellness benefit. Keep in mind that this is not a major medical plan, definitely not Affordable Care Act compliant, which is where, we've all gotten very used to all of our preventive care being paid in full. So annual physicals, mammograms, pap smears, colonoscopies, all those things that a employer plan might pay today, or any plan that's Affordable Care Act compliant. That is not going to be the case with this indemnity plan, but it will pay at least $100 towards a preventive or wellness care exam. In most states, there is a 6-month waiting period though, so you would not be eligible for that wellness exam reimbursement until after 6 months. Again, this is another area where you could see some out-of-pocket costs depending on, the services that you got, whether or not you stayed in the network, so you could take advantage of the network discount. But again, those are not areas where you should incur extremely high costs, like when you're hospitalized or needing a surgery or something. So that is the wellness benefit. What is really interesting about this plan is some of the options do actually provide a prescription benefit. So Choice Plus, again, kind of the go-to plan if somebody has other coverage, if they're pairing it with another medical plan, it will actually reimburse up to 12 times per year your prescription at the rate of either $20 if it was a generic or $40 if it was a brand prescription. So again, going along with the lines of an indemnity plan, you know, Walmart has a whole list of generic prescriptions where you only pay $4. Because this is an indemnity plan, this is going to pay you what the benefit says. So $20. So if you fill a generic prescription for $4 every single month, it's your only prescription. And you fill that, like I said, for $4 every month at Walmart and then submit your claim for reimbursement, you're still going to get a check for $20 because that is your benefit. And you're going to be ahead $16 every month just on your prescription. It does walk through exactly how you take advantage of the prescription benefit. For outpatient services, now this encompasses actually quite a bit of important benefits. So we're going to spend just a moment here. But the first one is your outpatient lab x-ray and diagnostic benefit. It's going to pay $200 for labs and x-rays. Again, that's going to be non-preventive, non-routine. So it's diagnostic testing. And that benefit is exactly what it sounds like. When you're going to get lab work done, you know, your blood being drawn, and then x-rays with an x-ray machine. Now, the diagnostic benefit, you can see it pays more than double at $500, one test per year. That is going to be some of your more major diagnostic testing. So MRIs, PET scans, EEGs, CTs, those more major imaging or diagnostic tests will fall under that benefit. You would be reimbursed, or the provider would be eligible to be paid up to $500 for that. Down here you see two cancer benefits. So one of them is oral chemotherapy. So that is actually covered under the medical portion of these benefits, not included in the prescription portion. And that is going to be exactly what it sounds like, an oral chemotherapy drug. The plan is going to pay up to $1,000 per month for 3 months. And then that benefit is going to be exhausted for that calendar year. Now it'll pay that again the next calendar year, but that will only pay 3 times for a total of $3,000, $1,000 each month for 3 months in one calendar year. Now, do not confuse that with the chemotherapy that most people think about when they think about chemotherapy, where you're going in having the treatment done through an IV, either in an outpatient hospital or facility setting, or sometimes in a doctor's office. That outpatient chemotherapy or radiation benefit is going to pay $1,000 per day, up to 40 days in a calendar year. So that is a really good benefit, would get most people through a cancer treatment. Obviously, there's tons of different cancers and tons of different treatment plans. I know from personal experience with my mother, for example, that would have covered her radiation. She had 35 treatments of radiation, but she had 16 rounds of chemo. So both of those would have happened in the same calendar year, which for her, they did not. So this actually would have worked out for her. But if those fell within the same calendar year, the treatments exceed the maximum benefit here. because it was 35 plus the 16. So she had more than 40 treatments. But like I said, in her situation, though all those treatments didn't happen in the same year, and that limit of 40 days of chemo or radiation only applies to each calendar year. So that is kind of an overview of all of the main benefit categories. The schedule of benefits that you would receive if you enrolled in this policy does get more detailed as far as breaking down some of the surgical procedures and stuff like that. So it does get a little more specific, but those are at least the common categories that you would see and how you can expect your benefits to work. There are, and I'm happy to provide this brochure to anybody, but there are exclusions and limitations that it is very important that you review and make sure that you understand and understand how the policy is going to work. We're not going to go through all of these, but I just wanted to point out to keep an eye out for the state specific, either exceptions or additional limitations that may apply. So for example, in most states, so this is exclusions, they're not going to reimburse for treatment of mental disorders or substance abuse. But in the state of Arkansas, they're only not going to reimburse for substance abuse, but will reimburse for any cost you incurred for mental health services, just as an example. Very important provisions of the policy. We will kind of touch on these because it is important to understand. First and foremost, here on the right, this plan is subject to medical underwriting based on your health. When applying, you answer a series of yes or no questions. Usually, in general, if any of the specific questions that they ask are a yes, the policy is not going to be issued. They ask what we refer to in the industry as the knockout questions. But if you're able to answer no to most of those questions, a lot of times the next step is going to be a prescription drug check. So they will access, the underwriters will access the MIB, which is a medical information database, and just take a look at your prescription drug history over the past year or two and make sure that there is nothing in your drug history that conflicts with any of the answers that you on the yes or no questions. What they will also look for is medications that are related to specific conditions that would cause a person to be denied, such as cancer, congestive heart failure, HIV or AIDS. A lot of times insulin dependent diabetics have a hard time getting approved for these plans. They will also look for 3 or more medications treating a single condition. A lot of times that can indicate that maybe a condition is less likely to be under control and being successfully managed by medications. If you have any questions about whether or not you think you would be approved for medical underwriting, please don't hesitate to reach out. I'm happy to kind of talk you through that. I do have access to some of the more general underwriting guidelines. I can usually check your prescription drugs and make sure that they are not on the knockout list. But again, I would not be able to guarantee that you would be approved or even denied for the policy. But I could help talk you through at least your likelihood of being approved. I want to touch on the pre-existing conditions here as well. I find that a lot of people have a misconception about pre-existing conditions. They fear that if they ever had a specific condition at any time in their past, that if it recurred, it would not be covered under a plan that has a pre-existing condition provision. So please hear this clearly, read the words highlighted. The pre-existing condition clause is not a exclusion of any condition you've ever had for an indefinite amount of time going forward. So the way that they look at it is that a pre-existing condition, first of all, will not apply for longer than 12 months after the person's initial effective date under the policy. And it is only going to apply to conditions within the 12 months prior to the policy. So 12 months immediately preceding the initial effective date at which the person became covered under the policy. That's also not going to apply for individuals in Colorado, Nebraska, or North Carolina. So if you're able to pass the medical underwriting, answer no to all the knockout questions, no concerns from the underwriter, and the policy is issued, you actually do not have a pre-existing exclusion apply to you. So that's really great. But also it's worth noting that it's not a blanket exclusion that they get to apply however they want, whenever they want. So I've also come across a lot of people who are concerned that say because they are on high blood pressure medication or high cholesterol medication or even both, that is going to be considered a pre-existing condition. And if they were to have a heart attack, that would not be covered because they were on high blood pressure or high cholesterol medication. That is not the case. So a heart attack would not be covered due to the pre-existing condition clause if somebody had had a heart attack within the past year, or some sort of cardiac distress that is similar to a heart attack. So simply being on medications for high blood pressure, for example, is not going to cause a heart attack to be considered a pre-existing condition. I hope that example kind of made sense, but most people who would have a heart attack denied for pre-existing condition in the first 12 months probably would not be issued the policy because cardiac events are one of the underwriting questions. So if you had to answer yes to that, it is likely that the policy just would not be issued. So the pre-existing would not even be a concern. There's additional fine language that you always want to read through, but these were the key topics that I wanted to walk through and point out. It is always good practice to make sure that you read benefit brochures, schedule of benefits when you do receive a policy end to end to make sure that you understand exactly how the policy will work. Now, let's take a look at what an indemnity benefit looks like, especially cost-wise, paired with another type of medical plan so you can kind of get an idea for the big picture. All right, this example is based on a 60-year-old female with a Texas zip code. So do keep in mind the age of the applicant, gender, whether or not you use tobacco, and even your zip code, just demographically where you're located, can impact the premium. So definitely do not assume that if you're 49 or 59, that this is exactly what the cost of the Choice Plus indemnity plan would be for you, even if you do live in Texas. it's important to put in your exact date of birth, gender, and zip code, like I said, so their system can quote you based on that. But this is the Choice Plus plan, which is the benefits that we walked through previously. So I am not going to go over this in detail, but let's kind of relate this to if you had plan A. So let's say you had a inpatient hospitalization, 5 days, okay? Your plan A benefits from the railroad plan are going to be $1,000 deductible. You then pay 50%. The plan pays 50% until you've reached the $15,000 out-of-pocket maximum. And then the plan is going to pay 100%. That's your plan A benefits. This plan is not going to coordinate with your plan A at all. It doesn't care if plan A covers or denies, how much they pay or don't pay on that 5-day hospital stay. If it was a hospital stay due to sickness, you're going to get paid $2,000 per day for those 5 days. So $10,000 check is going to be issued to either you or the provider. At the same time, like I said, your plan A benefits, you will likely be responsible for the first $1,000 if you had not met anything towards your deductible yet. But then the plan's going to cover 50%. It's possible that if you were not in ICU, that you were not having surgeries, let's say that you were just in the hospital for some pretty basic observation, you weren't getting kidney dialysis or anything like that. It is very possible that the negotiated rate could be, $1,500, let's say. So United Healthcare is going to process that claim based on the $1,500 per day negotiated rate. You're going to pay that first $1,000, but then United Healthcare, the railroad plan, is going to pay 50% of that $1,500. So you're only going to be responsible for days 2 through 5 of $750. Meanwhile, you're going to have this policy paying you $2,000 per day. So when that all nets out at the end, it is very possible that in an inpatient hospital situation with both of your plans processing the claim, that you could actually end up with all of your doctor's bills paid, plus a couple $1,000s coming to you in the mail, because of what is left over on the indemnity plan. Again, these benefits we did review in detail, so I'm not going to go over them again, but let's look at what these costs look like for a railroad plan, and the indemnity choice plan are the benefits and costs that I plugged in here. And this is a real example from the wife of a railroader in Texas, who the railroader was going on Medicare. The spouse was faced with almost $1,300 a month in COBRA, which neither one of them wanted to pay, but she wanted to make sure that she still had access to all of her same doctors. Knowing she was pretty healthy, she knew that she didn't have a need to pay for the almost $1,300 a month in COBRA, but she did not want to take any risks at all when it came to protecting them financially if something did happen. No matter how healthy you are or how well you take care of yourself, the fact is that we don't have crystal balls. We can never know for sure what we face right around the corner. And that was important to her. So she went with the plan A, again, with the benefits of a $1,000 per year deductible. The plan would then pay 50% until she had spent $15,000 out of pocket, and then the plan would pay in full up to the lifetime maximum of $500,000. So that was going to run her $455 per month for the premium for Plan A, which is a huge savings compared to the $1,288 that she was going to pay for COBRA, and still have a out-of-pocket maximum of $5,000. So we also added the Choice Plus Indemnity plan from United Healthcare's Health Protector Guard portfolio, and that ran her $307 per month. You can see how adding these two plans together, you have a deductible, coinsurance, and high out-of-pocket over here on Plan A, but a really low premium, and that's because it's got that $15,000 out-of-pocket maximum. But you can take on that low premium, add in an indemnity plan. So that's going to cut in to how much money you're saving Plan A compared to COBRA, but you have the potential to offset most of your out-of-pocket costs, illustrating for you kind of the first and foremost, the strategy. You can see down here, the strategic approach is to enroll in the three plans, which is the Railroad Plan A, Indemnity Plan, which would help offset day-to-day out-of-pocket costs, and the Cancer, Heart, and Stroke Plan. But with all three of these plans, you've reduced the premium significantly compared to the COBRA option. You've, like I have said before, hopefully eliminated, but if not, dramatically reduced any exposure for out-of-pocket costs. That's the deductible, coinsurance, and out-of-pocket that you have from the Plan A. And then also provided an extra layer of protection with the Cancer, Heart, and Stroke benefits. So definitely something to look at and consider. I feel like this was a good example of showing you how you can strategically make your healthcare dollars stretch as far as possible. It's not always about what is the cheapest and how can you pay the least amount in premiums, but looking at both sides of the coin, how can you not spend more than you have to and make sure that those dollars that you are spending on premiums are going to go as far as possible for you. For hanging in there with me and watching all that there is to watch about the secret sauce, my plan recommendations to save money avoiding the cost of COBRA. I hope you all have a great day, and thank you for watching.